Well, welcome to the show today, Dr. Van Vliet. It's so nice to have you here.
Thank you very much.
Good. How long have you been at Brunswick Novant Medical Center?
I just started in August.
In August, so
Yes,
you're the newbie.
I'm the new guy.
Well, I'm curious, what brought you to Brunswick County?
Actually, I live in Wilmington, so
Oh,
I'm not too far away, but it was time for a change in my career. I've been in large regional medical centers for the last 16 or so years of my career, so it was time for a change, and I was looking forward to, I was looking for a place to go to where I could play a bigger part in patients' care and be a little more personal, a little more involved, and just kind of have a little more intimate setting where I could be more active in their care. And the large medical centers, you get kind of lost, and it's kind of frenetic, and this just kind of stumbled upon me and
Oh, that's
worked
great.
out perfectly.
Oh, that's great. And you didn't even have to move.
No, it was funny. It came, I was just about to accept a job in Colorado, and literally within 24 hours, and I got the call and told my wife we didn't have to move. And
Oh my goodness.
She was
and she was happy.
Yes, so were the kids. They got to stay in their schools, and everything was great.
Oh, that's wonderful.
Yes, ma'am.
That's wonderful. Great story. Well, talk to me about your education and your background. How do you become an anesthesiologist?
Well, typical pre-medical training, just like everybody else. I did most of my training, or all my training, in the Northeast. I'm a Northeast boy, and I crisscrossed Pennsylvania through college, 4 years of college, 4 years of medical school, and internship. So just typical medical school process. And then after medical school, like most doctors, you choose which specialty you want to go into, and I chose anesthesia. And so I did my anesthesiology residency in New York, and I went up to Strong Memorial at the University of Rochester and completed my residency in New York. And then, like
Great
I said,
facility.
Yeah, it was fabulous place. But like I said, and if you include, like I said, the last 16 years plus the training, you know, like I said, it's 20 years now.
You don't look old enough to have
no,
been there.
No, well, it has been a while, but yeah, 20 years in the big facilities with, you know, the high-risk OBs and lots of pediatrics and the trauma and the neuro and things. So, like I said, it was time to kind of step back and enjoy life for a little while and a change of pace.
Kind of the best of both worlds.
You got it. It's a nice change.
Yeah. Well, tell me about the team, the anesthesia team at Brunswick Novant Medical Center.
Fabulous team. I couldn't have asked for better. There's 3 doctors, Dr. Brand, Dr. Mix, and myself. And then there's a fabulous crew of currently 5 CRNAs, and the way things are going, the place is expanding. I wouldn't be surprised if there's, you know, if we get a few more here in the next little bit, but 5 CRNAs or nurse anesthetists that we all work as a team in the care of patients, and there's one of us through, you know, with the patient throughout the entire time, and if not 2 of us throughout the beginning and critical points of cases.
Okay, well, let's talk a little bit about anesthesia. Give me a brief overview, I'm sorry, of what anesthesia is.
Anesthesia is, it's kind of like witchcraft. Not many people understand exactly what we do. We're the Lone Rangers. We come in with our masks, and people don't really understand what we do. But it's the specialty where we provide pain relief and amnesia for surgical procedures. So I
like that amnesia part.
Right,
I've had
you don't
surgery.
remember.
I don't
you don't remember,
remember.
and you don't feel, and you're comfortable throughout your procedures. Basically, we make sure you're comfortable and don't remember anything. But also, I think a big part of things that people don't realize about anesthesia is that we're dealing with people in a very stressful, critical point when they come in. I mean, surgery is stressful for people.
It is.
Whether even a routine hernia or an appendix can be, you know, it's scary. I mean, people,
it is.
You know, an operating room is a different place for people. And you come in and you're stressed out, and you know, some people are terrified, you know, just let alone needles, operating rooms. And so what I was saying before, being more involved in a more personal, intimate way, dealing with people is during that stressful point, whether you, through reassurance and through education and telling people and educating them about the procedure, as well as through medicines, to relax them and relieve their anxiety and stress level during that and before and after the cases is a huge part of my job, and making sure that their experience is as pleasurable as possible and as stress-free as possible.
Now, I know there are different types of anesthesia.
Yes,
sometimes you go to sleep, and sometimes you just lose feeling. Talk a little bit about those different types.
General anesthesia is what probably most people think of, where you're rendered unconscious. Where
That's where you go
totally
to sleep.
Asleep, correct. And most of the time you have a breathing apparatus, whether it's a breathing tube or we have special face masks and things like that. But where you're unconscious, you're asleep, we wake you up. You go to sleep, and we tell you where people think you count backwards, and the next thing you know, you're in the recovery room, and it's all done. That's a general anesthetic, all anesthetics you'll need an IV for. Right. But the general anesthetics where you're rendered unconscious, and we put you to sleep, and you're hooked up to the ventilator. We take care of the breathing and all. Basically, we control your vital signs and your physiology during that period. There are spinal and epidural anesthetics where we basically anything from like your belly down we're covering, or the lower half of your body, whether it's lower abdomen, your lower extremities, where you don't need to be totally rendered unconscious. It's a misconception that you have to be wide awake for that. You absolutely do not. We can still keep you asleep, and you don't need to hear anything that's going on, or you can be as asleep as you'd like, but the main comfort level or pain control is coming from that spinal or epidural.
I see.
It consists of an injection in your back, which sounds worse than it is. Most people hear those wives' tales or the old horror stories or things like that, where you can get paralyzed. All those things that don't happen. That's not true. And it sounds worse than it is having a needle back there. I've had an epidural. It's not awful.
Yeah, I've had one too.
And it's not a bad thing. The difference between the two is a spinal has a very finite lifespan of how long, depending on what medicine we give you, how long that lasts. It's a one-time shot, and certain medicines last an hour, certain 2, 3, whatever we choose will last a certain amount, whereas an epidural, we actually leave a small catheter in the back, and that can last for days.
Oh, you could extend the time.
Correct. Or like when women have it for labor. Some women's labor go quick, some women's labor last for a day. And so we can extend and just prolong and give medicine as long as we need to through that catheter. And there's a third type that's gaining popularity, is called regional anesthetic, where we can just basically put a region of the body to sleep, or like if we're working just on the wrist or just on somebody's arm or leg, and we can just put that region to sleep. And so with the advances in, especially with ultrasound, we can use an ultrasound machine and identify the nerves, say in your neck or in your hip or things like that, and just numb a certain region of your body. Again, you can be sleepy during those procedures, but if some people have certain medical issues that we shouldn't put them to sleep, or it's not safe to put them asleep, or they don't want to be put to sleep, that their procedures will allow them to have this type of anesthetic. I can just put your ankle to sleep if we're working on your toes. So it has certain risk benefits that we weigh for each individual.
So that's how sometimes you choose the right anesthetic for the person, because you decide based on their health and their condition.
Every case is different.
Absolutely.
And so the surgeon, the actual surgery, the surgeon's needs, medical issues, as well as patient preference. I mean, you and I, we determine what your anesthetic's going to be.
That's a great.
It's not determined which way you're going to go before you set in that hospital on a lot of cases. And you play a role into which way or what anesthetic you're going to have. And we determine that, you and your anesthesiologist determine that the day of surgery.
Wow. Well, it sounds like you have a great program at Brunswick Novant Medical Center.
Wonderful.
And it sounds like you're doing a great job, and you seem very happy there, and I'm sure they're happy to have you.
Pleased as punch.
Yeah.
Yes.
Well, thank you so much for being here today. It was a pleasure having you. I look forward to seeing you soon.
Thank you for your time.